Hi, my name is Zoe Padilla, and this is my speech on von Willebrand's disease, and this is my audience. There are all types of well-known illnesses or diseases that anyone could make a list of, but what about those other ones that were never heard of and the effects these have on people you may or may not know in your everyday life? Von Willebrand's disease, a blood disease discovered in 1924, is a blood disease that affects the clotting of your blood. Today, I'm here to inform my fellow COMM 110 students on von Willebrand's disease and its origin, the symptoms and diagnosis of the disease, and the difference between the three types. To begin, let's start on the first point of discussion. My first main point today is the origin of von Willebrand's disease. The origin of von Willebrand's disease starts in the year 1924 when Erich von Willebrand discovered the disease through a young Finnish girl. He had recognized that it was different from hemophilia, a similar disease. The difference was one is hereditary and von Willebrand's disease is not. Erich von Willebrand had discovered a large group of Swedish and Finnish people who were linked genetically through the genetic mutation caused by von Willebrand's disease, as stated by the Hemophilia Foundation of Southern California. I have just discussed my first topic, the origin of von Willebrand's disease and how the link through genetics made it different from other disorders and diseases. My second point of discussion is the symptoms and diagnosis of von Willebrand's disease. Von Willebrand's disease is one of, if not the most common bleeding disorder, typically diagnosed by looking at family history of bleeding and then laboratory testing to prove the abnormal von Willebrand factor in the blood, stated by Frank Liebig. To even be considered for diagnosis, you must have a background of persistent chronic bleeding that happens often. An example of a situation was when I was 4 years old. I had a bloody nose every day over the summer. They could last for hours at the worst, and my parents had no clue what the problem was. With both my parents having no background with blood problems, they were at a loss. They eventually went to a doctor about it, and I had my blood tested to see if I had any abnormalities involving the blood factor 8. The test came back with a slight abnormality, which later led to my diagnosis of von Willebrand's disease type 1. With this diagnosis, my life was changed, but the restrictions I have are none too few. One of the many symptoms of von Willebrand's disease is easy bruising, which leads to most sports being out of the picture. I tried volleyball, but had to quit because my arms would bruise from the contact of the ball. Other examples would be when I got my wisdom teeth removed, I had to get a transfusion of the factor before the procedure and was on clotting medication for a week prior. Other ways that von Willebrand's disease can be spotted, as stated through BCDI, my local bleeding and clotting disorder office, are again easy bruising, frequent exercise, frequent or excessive nosebleeds, heavy and prolonged bleeding after surgery, dental work, injury, or childbirth. I have just discussed my second point of discussion, the diagnosis and symptoms of von Willebrand's disease through some of my own personal experiences. My third and final point of discussion is the three different types of von Willebrand's disease. Von Willebrand's disease, like diabetes, has three different types, each one getting slightly worse as the numbers rise. The most common of the three is von Willebrand's disease type 1, which is what I am diagnosed with. Type 1 consists of the von Willebrand factor being fewer or less than the normal distribution curve as stated by Journal of Thrombosis and Hemostasis. Type 2, which is the next step up, is when factor 8 does not work consistently and bleeding is far more frequent and heavier than in type 1. Type 2 is broken down into four subtypes. 2A, where clots do not form properly. 2B, where the factor works when it is not needed and causes lower levels due to excessive use. And 2M, where the factor does not connect and a clot does not form. And finally, 2N, where it attaches to platelets but does not attach to another protein to form a proper clot. Type 3 is by far the most severe and can only be genetically inherited. This type of von Willebrand's disease is close to 0% of the von Willebrand factor, and only 3% of people with von Willebrand's disease are diagnosed with type 3, stated by the CDC. I have just discussed my third point of discussion, the three separate types of von Willebrand's disease type 1 and through type 3. To conclude this speech has just discussed the origin, symptoms, and diagnosis on the three types of von Willebrand's disease. While it is very common, blood diseases is not nearly talked about as much as it should be. Being something that is very easy to help treat, knowing about a possible blood disorder could be helpful to anyone. Thank you for listening.